Hi, thank you to everyone online for joining us for today's Health Tech Thursdays, Virtual Mental Health. Presented by CSE and KASCorp, we are pleased to have 3 companies and 1 guest moderator. First company and person presenter is Karen Adams from CloudMD. She's the Chief Innovation Officer and Global Head of Enterprise Health Solutions. The second is Danny Weill, Vice President, Sales and Partnerships from LifeSpeak. And the third is Dr. Arash Zohoor, co-founder and CEO of Inkblot Health. Our guest moderator, Sam Duboc, Executive Chair and CEO of MindBeacon. What is Health Tech Thursdays? This is an opportunity where we wish to connect investors to companies involved in a specific area of digital health tech. We have been running the series for a number of weeks, and this week is a special one for me and a special one for us because we're talking about mental health. And January being the month for it and mental health awareness, we felt it was appropriate to have it at this time. Now, I want to get into some housekeeping matters. You'll notice a red reconnect tab at the top of your screen. If you lose audio, just click it and you'll be reconnected. In the event that there's technical problems, we may hit the restart, in which case there is no action required by you. The system will automatically reconnect everyone. We aim to run the show to 45 minutes. The chat board may be utilized to ask serious questions. Please be clear as to whom your question is directed to. We also have a lengthy disclaimer, which I'll post in the chat board, and I won't bother reading it now, but we want to make sure that we get to it. Each company will have 7 minutes to present their PowerPoint, and when you see my face appear, that means they'll have approximately 30 seconds to wrap up. This couldn't be done without our co-host and our co-host sponsor, KASCorp. And with that, I'd like to introduce you to Jason Boboikis, and he will also introduce our moderator. Jason, take it away.
Hello, folks. I think by now everybody's heard my piece of the talk, so I'm going to jump right into it because we've got a pretty power-packed day. It's with great pleasure I get to introduce our guest moderator for today, Sam Duboc. When I first heard his story and kind of learned about his long list of accomplishments, there was part of it that I just didn't know. So I asked him to come on to share his story so that people can really connect and understand that, even people with a long list of accomplishments as he has, can have challenges that can be overcome. Just to put things in perspective, Sam is co-founder of Edgestone. He was managing director at CIBC Capital Partners. He was co-founder and COO of the Loyalty Group, which is the parent company of Air Miles. He was special advisor to a team implementing the government's plan for venture capital in Canada. He was chair of the board at the BDC. The list goes on and on. I've got another dozen or so companies to list where he's been in senior roles. So without further ado, I'd like to introduce to you Sam Duboc.
Great, thank you so much for that kind introduction here. And I thought we'd start by just rolling a bit of a 56-second video on MindBeacon. So my story really is one, as you heard, I'm a serial entrepreneur, having started a number of businesses. I also suffer from depression and anxiety. And what really brought it to the whole is back in 2011, October 18th, actually, my brother died when he was walking to work. And that caused me to go into a deep depression. And notwithstanding I'd been on the board of the Center for Addiction and Mental Health, I knew exactly what drug I wanted. I knew who to call. I knew the whole bit. It was hard for me to get treatment. The stigma, the time, the effort, the financial implications of it all conspired to me like they conspire to everybody. So after talking about it for 2 or 3 years, my wife, Claire, got together with 2 doctors and started MindBeacon. And the goal is real simple. Our goal is to revolutionize the delivery and access of high quality mental health care with a world of healthier minds and better lives. Put really simple, we want you to get what you need, when you need, how you need on your own time. Make it affordable, accessible, and available. And it's a big problem we're tackling, as you all know. 1 in 5 Canadians will have a mental health event this year, 50% by the time we're 40. But the striking statistic is 2/3 of people won't seek help. Can you imagine if this were cancer, where 100% of people would seek help? 2/3 of people will not seek help. Why? They don't want to talk to anybody. They don't want to be there. They don't want to have to go through the hassle. They don't want to go in. They don't even want to look face to face, we're finding, in our virtual systems. Now, we believe very strongly in the stepped approach to mental health care. And this was a diagram that's loosely taken from Dr. Peter Cornish. And Dr. Peter Cornish is one who's come up with the stepped approach to mental health care model here in Canada. And what this basically says is, let's start with low intensity interventions and try and see if that works. If they don't, we'll step you up the ladder of intensity. And what also means step up the ladder of how expensive it is to deliver, how difficult it is to deliver, all the way up to and including, unfortunately, if you need to go into acute care at some place like the Center for Addiction and Mental Health. And what's important about this model is you have to be able to access it. You have to be able to understand where to go and to navigate. And in today's world, it's very difficult to do that. It relies on the individual who, by the way, when you're depressed and not feeling great, you don't think necessarily always perfectly clearly. So we took this model, and the key integration, the key thing that MindBeacon has done is we put you in the center. We offer all the supports increasingly that you'll need, and in the next few years, you'll see us develop into a full support, whether it's light intervention and self-navigation, whether it's synchronous, meaning real time, in-person, texting, in-person video, in-person, or whether it's the asynchronous digital platform, which we used to call Beacon, we now call the MindBeacon Guided Therapy Platform. It's important to offer a broad range of supports to give people what they need, when they need it, especially since people are suffering from a whole variety of mental health conditions. You can see just some of the conditions that we treat on the right. And it's important to do it in a highly measured, highly data-driven, efficacious manner. And you can see here that 2/3 of our people get significant clinical improvement, 82% get clinical improvement. And we have high SAT scores, which we're very, very proud of. So that's a bit of our story. In December, the market recognized us by allowing us to go public. We were significantly oversubscribed. We trade under the MBCN on the main exchange in Toronto, about $300 million of market cap. So that's the MindBeacon story. I'll turn it back over so we can hear about 3 other great companies.
That's great. That's great, Sam. Thanks for the intro and the background. So our next speaker is Karen Adams. She is Chief Health Innovation Officer and Global Head of Enterprise Solutions at CloudMD. She brings over 20 years of experience in building insurance companies and driving innovation and growth in public and private companies. She's been nationally recognized for her contributions, and she was very key in the Canadian marketplace in terms of building out employee assistance, building out the employee assistance industry by convincing organizations that investing in mental health would increase productivity and well-being. With that, I'll leave it to you, Karen.
Thank you for that. Very nice introduction. So we are a publicly traded company. I am very excited to work at CloudMD. I think a lot of what Sam said is true. I think we're seeing the industry move to putting the patient at the center. I think for us to overcome the mental health issues that we're experiencing with access to care, the patient has to be at the center. I'm not going to go through all the stats, but I will concur with probably every one of the speakers today that there are really three themes we're seeing. Access to care is the #1 problem that people experience getting treatment. 14.9% of Canadians don't have a family doctor, and that's obviously the first entry for a lot of people to getting help for mental health. Wait times are at an all-time high for mental health. So if we look at 20.8 weeks and we have a mental health issue, that's a long time. And diagnosis. One of the things that we know is that without a diagnosis, how do we provide proper access to care? And I would say that my insights over the last 20 years has been that if we have a physical health issue, we immediately get on the bandwagon and diagnose the mental health or the physical health issue. With the mental health issue, we treat it as a big category. And the challenge is we need different treatment plans for different mental health issues. As far as the marketplace goes, the private pay industry, you can read the stats on the side. It's growing exponentially. And I think there's a nice mix right now between the private and public around the mental health and people understanding the importance of private pay. From a business model side, what I will say is I agree wholeheartedly. The continuity of care is the most important thing. What I need today may be different than what I need tomorrow, and that is very much about creating a navigation system, a system that enables us to understand where somebody is today. I think the other important thing at CloudMD that we talk about is really the ability to be reactive and proactive. So much around mental health is reactive, where somebody has a situation and that's when they're going to get help. But we have a huge opportunity through assessment tools and risk factors to understand what am I predisposed to, and starting to get those proper treatment plans proactively so that people can get help. We have acquired a large number of companies, and our acquisition strategy is purely around finding the clinically evidence-based programs that can be integrated to put the person at the middle and provide them access to care in the way they need it, whether it's bricks and mortar, whether it's an app, however the person is comfortable getting that care, and providing access to care is the most important. The client engagement, providing people with information. So the IMD acquisition really enabled us to start and educate and inform. You leave the doctor's office, you forget. You leave the counselor, you forget. Having that access to that information that you can read on your own time and digest. Medical confidence is the navigation that takes it from the disability perspective and really starts to create specialized, customized treatment plans. And then Humanicare and Snap Clarity is 7,500 counselors that work the way an individual wants to work for mild, moderate, and chronic, psychotherapists, psychiatrists, and psychologists. You're going to see a lot from CloudMD in the next little while. We are developing an integrated platform. I characterize it as a highway. We have the highway and we're creating the off-ramps to the products that people need. But on the highway are navigators who are the voices in your ear, understanding where you are today, calculating your needs, and then getting you the specialized care that is both GP, who is helping you manage your care plan, counselors who are providing that support, and specialists for things such as chronic pain and some of those things. And really putting these companies together has enabled us to be a 400 million plus share cap on what we're doing because of the removal of siloed programs and saying, let us connect these programs. You shouldn't be deciding what program you need. Allow us to use data to drive to outcomes. I think one of the things that is really important about mental health that sometimes we lose sight of is that everybody has different genomics that drives their treatment plans, different social economic conditions. We're going through a period of COVID right now where we are seeing usages jumping dramatically. And I don't know if anybody saw it this morning, but there was a beautiful article put out by the CBC really talking about the youth and how youth are seeing a 30 to 40% increase in mental health around isolation, the lack of interaction. So we're seeing now a spectrum of everybody in Canada and North America and worldwide experiencing mental health in very different ways, and whether it's isolation or fear. And the coping behaviors that are required can be anything from educational resources to intense psychotherapy. We're seeing a huge increase in substance abuse issues. So the scope is as large as a physical health issue, that really, without nurse care managers and navigators who are doing the symptom checking and creating the personalized wellness, and then checking in and creating progressive measurement to reassess and changing the treatment plan so that people can live in the new norm, whatever that new norm is for the person. Because there's a huge misnomer in mental health that somebody's going to recover going to therapy, and it may be that they have to adjust and have a new norm. So the real benefit of the CloudMD platform is our ability to really bring this all together and create the highway that allows people to get the access to care when they need it. Thanks, Jason.
That's fantastic, Karen. I think you've presented a lot of the issues that are seeing very, very clearly. That's great. So our next speaker is Danny Weill. He's Vice President of Sales and Partnerships at LifeSpeak, which is a leading digital engagement platform focused on employee well-being and professional development with a focus on mental health. They take a little bit of a different approach to things, more from the prevention side. And Danny has accelerated the company's growth through strategic alliances and focusing on creating shared value for their partners and their clients. Take it away, Danny.
Danny, I think you're on mute.
Sorry, thanks, Jason. Thanks, everyone, for having me. Sorry about that. What's so interesting as I hear all the other companies present, Karen and Sam and Arash after me, is it's even though LifeSpeak plays in the similar space of employee mental health and supporting people, our platform is designed to go so hand in hand with these other programs. As an example, 100% of our clients have an EAP offering, and yet we fit hand in hand with that programming. So LifeSpeak plays in that area of preventative health, and we serve to be an individual's first line of defense, or that first line of self-care, through empowerment of knowledge and education, all delivered by leading experts. So I'm going to start with a couple of very visual slides to sort of outline the problem that we serve to solve and the scenario in which we play with individuals, and then I'll get into some of the corporate information. So the question that we serve to solve for an individual is, what are you going through right now in this very moment? It's not an area where you may want to speak with someone. You may not want to pick up the phone. You may not want to have a high touch engagement, but you need something for what you're going through right now. And so the question we ask of our employers is, what if you could put a leading expert in front of that individual right in that moment? What would be the impact? And then the next level of that is, what if you could put 20 experts in front of that individual, allowing them really to self-direct based on what they're going through right now? And at the highest level, what if you could put hundreds of leading experts right in front of that individual in that moment, allowing that highly self-directed learning and self-directed care in that moment, and then allow them to take the next step within their journey, which may be to some of the other services that you're hearing today as well. But it's really that first step of preventative health to get the support they need in that moment digitally from a leading expert. So here's what LifeSpeak provides. It's around the clock access to leading global experts on, like I shared earlier, whatever an individual may be going through, whether it's mental health, preventative health, financial stresses, family matters. It is a very well-rounded answer to what we all may be struggling with at any given moment. So we marry technology with content and then top-notch curation of that content. all delivered in a web-based, easily integrated platform. So a bit about the company. We were founded in 2004, and we were founded as a live training company where we brought the experts into our clients to speak in person, and then quickly in 2008 pivoted to a totally digital solution and haven't looked back since. So today we have over 2,300 custom produced expert-led video trainings, and we own all of the content, and all of the video trainings are in a micro-learning format. From a Canadian perspective, the program is entirely bilingual, with Anglophone experts for the English community and Francophone Quebecois experts for the French population. We have over 500 clients and a very healthy 97% client renewal rate, with global distribution and a growing global sales team. So we've expanded our sales team outside of North America as the product expands nicely outside of North America. So a bit about us from a corporate perspective. So as I mentioned, 16 years in business, referred to by the Financial Post as the Netflix of health. And that's a great way to visualize the LifeSpeak platform for those of you who are unfamiliar with it. Of the 550 plus clients, we serve over 7 million lives. Our sales channel is both direct and through distribution partnerships, such as EAP, wellness companies, insurers, and health plans. We are a leading innovation provider, but I also like to say that we respond to social demands as well. And a great example of that is how we pivoted with the pandemic, structuring the content and programming to ensure that we were meeting the needs of our employers and their employees related to COVID-related stresses and mental strains. And then again, recently, pivoted to ensure that the platform was meeting the needs of the topics of diversity, inclusion, equality, and allyship. We own all of the content, and it's all remotely hosted. We're headquartered in Toronto. The model is a recurring SaaS revenue model, and our revenue doubled in 2020 and will grow again, and expected to do so in 2021. We had a recent minority investment this past summer of $42 million with round 13 Kensington Partners and Roynat Capital, which provided strong institutional investor support. So that provides a pretty good overview of LifeSpeak and where we sit in the market. Thanks, Jason.
That's great, Danny. Certainly filling a big need in a anonymous way to allow people to access the expertise that they need, which is great. Our next speaker, Dr. Arash Zohoor, co-founder and CPO of Inkblot Therapy. He's a trained emergency room physician with a special focus in mental health and addictions and chronic pain. And he frequently guest lectures on these topics across the country. He's a clinical professor at McMaster and has won numerous leadership awards, including the Ontario College of Family Medicine Award of Excellence. With that, Dr. Zohoor.
Hi, everyone. Thank you so much for this opportunity. I just wanted to quickly tell you about Inkblot. I hope everyone can hear me okay. I started this company 5 years ago as several of my patients died of suicide while waiting for care, and that was really disheartening and tragic. And I really was struck by, no matter person's walk of life or whether they had great benefits or were unemployed, really they had very poor access to robust mental health services, and that became the mission of Inkblot, to try to really recreate and reinvent the mental health care landscape from scratch. Along the way, we asked ourselves the questions of how do organizations support the employees' mental health, and more, how could they do things differently? Because despite the amount of money that is being spent in the industry, outcomes have unfortunately worsened. And so increasingly, companies have been partnering with us in providing more effective long-term solutions to their employees. And we're really proud of the various companies that we work very, very closely with, now in the hundreds, touching over 1 million lives in terms of the care we provide. And of course, as you've heard, the problem is significant. And to employers, it's also a huge, significant problem with over 500,000 Canadians unable to work due to mental health difficulties before the pandemic. And this number, as we know, has grown even more since then. And we're really proud of the work that we have done. On our platform, those who seek care achieve the same outcomes in half the length of time. So we're able to achieve somewhere between 30 to 100 to 150% improvement within 3 sessions. That's typically achieved within 6 to 8 sessions within the industry. As well, we're really proud of the fact that our solution is far more effective for men, for ethnic minorities, and for rural populations. And of course, the question becomes why. When we present this to organizations, and often they ask, well, what's the secret sauce? How are you making this happen? And there are really 2 components. The first is we really focus on that user experience. To us, mental health is a chronic condition like asthma. There are triggers and there are environmental factors. Everyone has different predilections to those. And when there's an exacerbation, different types of treatments are differentially effective. So we really want to make sure that the care is highly individualized and yet the most effective that it can be. The second component is, and along with that, of course, is that we really focus on the organizations. We focus on the culture of the workplace, and we really partner with organizations to address and assess and understand those factors equally. And that has been another key component to our success. Perhaps one of the things under the hood as part of the secret sauce that I'll quickly touch on is that, as Karen mentioned, evaluation and diagnosis is important. So evaluating the person who seeks services is important. And what we uniquely do is we also evaluate continuously the care providers. So with every session that's on our platform, the platform will learn what care providers are good at, what they're less good at, what they excel at, and that affects matching, that affects who people see as part of their team. So we uniquely monitor the effectiveness of healthcare providers that is sorely lacking, to be honest, in the healthcare system as a whole. And all of that combines to make us twice as effective as traditional services. The other thing we do is really think of mental health services very holistically. Sometimes someone needs to, CBT or IPT to help with the relationship dynamics. Sometimes someone needs to speak to a financial planner and sort out their debt and reduce that stressor, or talk to a lawyer. So to us, we really think of it as much stress management as not. I'm just gonna go through a couple other things. And really we put the employee in the driver's seat in terms of the services. We're very flexible with organizations in terms of the packaging we provide. And we really focus on the long-term care of the individual and bringing them all the robust various models of care that's available in the mental health sector. Thank you so much.
Great, thanks. Thanks to all the presenters, and you're getting to hear some great companies here. So what I'd ask is everyone turn on their camera and their microphone now, and let's go into a Q&A. Remind those of you on the telecast here that if you do have a question, please put it into the chat and we'll try to get to it. Let me start with a general question for everybody. Everyone talks about COVID and the effects of the pandemic. What are you seeing in your user data pre and post COVID?
I can jump in with that. So it's Danny from LifeSpeak. It's interesting that we've seen obviously the usage of programming under the areas of anxiety, depression, suicide awareness, loneliness, and addiction and substance abuse. We've seen that usage naturally increase during the pandemic. That's sort of an unsurprising outcome of the user scenario. The biggest change that we've seen in the pandemic isn't actually from the end. It's certainly from the end user scenario, but sort of the biggest surprise is actually from the client buying process and the client launch process, which is historically clients would make a selection on the product of LifeSpeak and then launch over a 60 to 60 day to 6 month period. Instead, over the pandemic, what we're seeing is, the launch period saying, we're ready to move forward. Can we launch in a week? And so it's clients that are, pushing the launch envelope because the usage scenario is, as expected, so heavily consumed in the fields of mental health in the pandemic. And I'm curious if Arash or Karen, you're seeing a similar outcome.
So from CloudMD, I would say, we're seeing a large increase in people actually using the program. So, depending on the business, we're seeing upwards of 30 to 35%. I think the interesting thing is that we are seeing people access care for anxiety, fear, and I'm not sure that perhaps that was what people were coming to us before. It was a perception that had to be some big chronic mental health issue that I've got to come to you for. And I think the other thing is that people are interested in their personalized wellness plans. So they're talking about how to create coordinated care with their family physician and being interested in a holistic way of looking at care. I would say that has been a big shift for us. So
let me move. Oh, sorry. Go ahead, Arash.
No, it's okay. Actually, I would say that you both spoke eloquently to it. That's fine. We can move on, Sam.
So Arash, let's go to you for a question. What do we mentioned throughout getting engagement and success. How do you all, and Arash, I'll start with you. How do you all think about getting engagement in your platforms from these companies? You have impressive client lists. How do you actually get engagement though of those employees?
It's actually been interesting. A year ago, when we spoke to employers about this, there was less openness in terms of communication channels, directly communicating with employees and so on. That has shifted dramatically over the last year, I would say. Where we implement and launch with large organizations within 24, 48 hours. And oftentimes they're completely open to us communicating directly with their employees, of reminding them of various services that are open to them. And organizations that in traditional scenarios would have had 20, 30% utilization, 80, 90% of them do their evaluations within 24 hours. So it's we find that the collaboration with the people department and the HR professionals is very different now, and it's been extremely collaborative and really fantastic working. I get very excited working on implementation plans with the organizations that we serve.
Sam, can I just add to that for a minute? I think
go for it.
Yeah, I think engagement is all around speaking to people in the way they want to be spoke to. And mental health is not something that one size fits all. And I think the assessment piece for us has been in particular where people can understand their risk factors and start to hone in. But I also think it's the opportunity I see somebody ask the difference between telephone versus digital. Digital allows us to do it where we want. We can do it at 9 o'clock at night when we're at home. We can do it at noon. We don't have the excuse that parking or traffic is an issue, or I don't want to get in the car. So I think that the engagement piece is really around customizing it. And the underserved market piece is there's often not a lot of providers available in some underserved markets. So this provides a connectivity to people.
Okay. So let me move on to another, and we'll come back to some other that you're talking about here. So the flip side of this is you all have helped revolutionize, as we're all involved in the changing, revolutionize the mental health care system. So a little bit in the vein of, okay, what have you revolutionized lately? Where's this going? What do you see in the next 2 years? What is emerging on the frontiers of this? Danny, I don't know if you want to start us off, and then Arash and Karen maybe fill in.
Yeah, I mean, Sam, prior to the pandemic, one of our criteria that we used to ask amongst our clients in the buying process was, do you have a decentralized employee workforce, right? Today, the answer is yes, 100% of our clients, whether they were previously or not, everyone's decentralized. Mm-hmm. And so, it goes without saying that the shift towards digital innovation, and it speaks to the question about underserviced communities, the shift towards digital innovation, being able to universally reach all employees with consistent programming, regardless of, and all individuals with consistent programming, regardless of location, regardless of the barriers that may have existed previously. That's the first trend that really has been a necessity outcome of the pandemic that we've seen. And the second trend is that what is traditionally defined as mental health, as we've talked about, suicide and anxiety and depression, that it goes so far beyond just those core drivers of what is naturally defined as mental health. A great example is for so many of us parents who have kids working from home or kids now studying from home, and the strain that puts on us and our work-life balance and our mental health. It's not a conventional mental health challenge, but it is one that needs to be supported from providers such as ourselves.
Okay. Anything to add on that one, Karen or Arash?
I would say I spend a lot of time thinking about this, so I can probably speak to this for hours. But in terms of where do I see things going, as Wayne Gretzky said, you always want to think about where the puck is going to be as opposed to where it is today. And I would say there are two trends that, like, overarching trends that I would identify that we're seeing. The first is that the expectations from the public healthcare system are shifting. And that is great to see. So as someone who works in the public healthcare system, I'm really excited about that. And there are interesting dynamics at play, both politically, but there's a lot more of change of public expectations, which has been interesting to see in terms of the driver. In the private sector and specifically in digital mental health space, there are a lot of players, internationally, and it's been interesting watching how it develops. One overarching movement has been towards more of a personalized, data-informed care, and as well, the other recognition has been that the problem is so significant and so under-addressed that really we need many approaches, and there's a lot of room for innovation to tackle this problem from various different ways. So I've seen success from very diverse approaches, and it's been really great to see this work playing out.
Okay. Aaron, let me ask you a question directly out of the chat here. I mean, you've been involved at, as was mentioned in your bio, you sort of helped develop the EAP when you were at Chappelle. You've been involved with Snap. You were involved with Cloud. You've been involved. How do you see digital mental health care expanding to underserved? How do you think about what you're doing, what we're doing in the health equity context?
That's a great question. So, the underserved markets has been a challenge for all of us in this industry. And I think, even as employers struggle with employees who are, I was involved in the Slave Lake issue back in the day. Mm-hmm. And, it is all about how do you provide equity of healthcare to all employees. And I think that the virtual care model, coupled with the ability to handle chronic pain and the access to care, used correctly, the virtual model allows us to connect all the dots for somebody where they may be waiting months, and like one of our companies, Medical Confidence, providing access to specialists and seeing reduced wait times of 220 days just by looking across the continuum and saying who has availability of an appointment. So, for me, Sam, it's about, the market is emerging to not a product per se, of which product is it, but it's more about what are the capabilities and being able to connect the people to those capabilities, and what's the best way to do that, where we can, virtually.
Makes sense. Okay, so I'd like to fire a question to each of you, if I could, and we're getting close to time. Just a specific question, then I'm going to come back and I have a final question for each of you, if you would, please. So, Danny, what areas of mental health are generating the largest demand for you, and how are you addressing these new demands?
Yeah, so I sort of touched upon a bit of the evolution, and so I'll share about how we're addressing it as a company. The world's changing at such a rapid pace right now, and so the biggest shift as a company is that we're in film production every 2 months versus previously might be 3 times a year or twice a year. We're in film production every two months to ensure that we're responding more actively to what's happening in the world, and ensuring that we're supporting that self-care support for individuals in a bit more of a real-time fashion. And so good example of that is topics such as living in uncertain times, or
Right.
as I mentioned earlier about parenting.
Right. Great. Arash, you talked about the proliferation of digital mentor platforms. What's Inkblot doing to stay ahead of the competition?
When we do our analysis, the reason that people use our platform is not the UI and the software, etc. It's because they feel better. So the overarching reason is I use your solution, I'm doing better in life. And so for us, the focus is how do we improve on that even further? How do we make the solution even more effective in getting people feeling better? And using technology as one of the tools that's available to us in making that happen. And not using technology for technology's sake, which is always very tempting. So and that road has been very exciting, pushing for that metric to be above and beyond.
Karen, you're digital, you're physical, you're everything at this stage at CloudMD. Are there any trends in mental health patient success using one medium over the other?
So we believe in the omni-channel support. We believe of the hub and spoke model. So we're the hub, we're the technology model. Our spokes are our clinical footprints. There are delivery modalities. There are live network. It's our virtual network. So really we see ourselves as the middle hub that can help direct and navigate people to the right care at the right time. And sometimes it won't be products that CloudMD owns or operates, but can create the offering too.
Okay, fantastic. You obviously have a shareholder in the chat. Okay, so very quickly, the one thing people on this call should remember about your company. I'm going to go from my screen left to right. Arash, the one thing.
I would say that for us, the big focus is long-term care and seeing mental health as a chronic condition.
Danny.
Prevention is the key to to meeting people's needs before they get to crisis.
And Karen.
Putting the patient at the center and stopping at nothing to understand the needs and create the care plans that lead to recovery and ability to cope with day-to-day life.
Yeah, and for us, it's making effective mental health care affordable, available, and accessible to all. With that, I want to thank the group, and I'll turn it back over to you.
Thank you, everyone on the panel. That was fantastic. I'm getting messages that people want to continue, but I know being respectful of everybody's time, we're glad we were able to have you for the time that we did, and we look forward to having these conversations in the future. Hopefully, once there's been more progress in making a real impact on mental health in Canada. With that, I'll turn it over to Barrington for closing remarks.
Yes, thank you everybody for attending our online audience, and great questions from the audience in the chat box. It really helps to round out this wonderful session. Thank you to our speakers, the moderator. This will be available on various platforms, including YouTube under CSE_TV. As well, I think we might put sample clips of this on Instagram. Please click, subscribe, follow for this content as well as previous Health Tech Thursday episodes, CSE_TV. Check us out next week as far as Tech Tuesdays. And that's the plug. This is an important subject. Talk. If you know somebody, if you think you know somebody, reach out, talk. That's where it begins. Having conversations that matter. And if you are interested in these companies, we highly suggest you reach out and share this content. Thank you very much. Thank you to the CSE for supporting this and other content as well. Take care and enjoy your day.
Thanks, everyone.